Now a 12 News exclusive. For years, Dr. James Fanale was one of Rhode Island's top healthcare leaders, but now Fanale himself is the patient fighting an aggressive form of cancer.
Target 12 investigator Ted Nisi visited Fanale at his home to discuss his medical battle and joins us with the exclusive interview.
Jim Fanale had been a practicing physician for decades and a top executive at multiple hospitals, but he tells me he still wasn't prepared for what he'd experience as a rank-and-file patient.
They put a barge right out there. You can see the barge.
As CEO of Care New England, Jim Fanale had a lot on his mind during the early months of 2022. Regulators had just rejected a proposed merger involving his hospital group. At the same time, he was also dealing with a nagging cough.
Every once in a while during the day, I felt a little lousy, and I took a Motrin, I felt better.
Eventually, Fanale agreed to go to Kent Hospital for a CAT scan.
I come back to my office, I looked up the result, and I see this thing, right lower lobe mass, necrotic nodes, post-obstruction pneumonia. So I had cancer of the lung that spread to lymph nodes, and I'm reading this report.
Fanale had stage 4 lung cancer. The rest of us sit down in an office with a doctor who takes out the chart, shows us, and tells us what it means. You are a doctor.
Yeah.
So you open your own chart, you're alone?
Yep.
And you had to read your own chart to yourself?
I freaked out. I didn't know what to do. I was always healthy. I mean, I probably cried. I might have yelled. I had the door closed. I mean, I was stunned.
When you saw that chart, did you say to yourself, I'm going to die?
Yeah.
What Fanale didn't know yet, scientists had made advances against lung cancer. He's now enrolled in a clinical trial at Boston's Dana-Farber Cancer Institute.
So I guess it's 19 months, still here. I think we've not become optimists, we've become realists. Vineyards across the way.
Between treatments, Fanale spends much of his time at his home on Cape Cod.
So go girl, huh?
Relying on the support of his wife, Deb, a retired nurse.
My favorite is you.
In February, he got to walk his only daughter down the aisle.
Nice picture of us.
Yep, I still have hair there.
Something he'd once feared he'd never get to do. I always hate when people overly sentimentalize getting sick,
yeah.
and being very sick. But as someone going through it, I have to imagine it makes you appreciate everything in a different way. Is that fair to say?
It's absolutely fair to say. I mean, I don't worry about the little things. Not at all. Who cares? And I try to appreciate all the good stuff, right?
Fanale also decided he wanted to share his story. He's just published a new book entitled Onward. When did you have the light bulb moment that said, I think I'm going to write a book about this?
About a month or two into it. All this was new to me. And I said, you know, I've been a clinician, physician seeing patients, really sick patients, for 40 plus years. And I thought I knew everything. But all the stuff you go through, I was totally unprepared for. So that was the motivation behind it.
And coming up new at 6.
But the poor patient has no way to know how to run this, get through this system. I feel badly for them.
Fanale's message to fellow doctors and fellow patients. With the Target 12 investigators, Ted Nisi, 12 News.
Now a 12 News exclusive continues. As we first told you at 5, former hospital CEO James Fanale has gone from doctor to patient following a diagnosis of advanced cancer.
New at 6, Fanale tells Target 12 investigator Ted Nisi about the lessons he's learned that he thinks all doctors and patients should know.
After 40 years as a physician and hospital executive, Jim Fanale says he thought he knew everything about the healthcare system. But now, as a patient with a critical illness, his perspective has changed.
I made it, actually it's 19 months this week.
Former Care New England CEO Dr. Jim Fanale taking stock a year and a half after a devastating diagnosis, stage 4 lung cancer. Do they have any idea how you got this? Why you would have gotten this?
Not at all.
Were you a smoker or anything like that?
Never.
Fanale initially feared he'd be dead within a year, but he's now enrolled in a clinical trial that has showed some promising results. Yet even after decades as a medical professional, Fanale says he was still taken aback by how difficult it is to navigate the system as a patient.
The poor patient has no way to know how to run this, get through this system. I feel badly for them. It's too complex.
The experience has spurred him to publish a new book, Onward, written for doctors, medical students, and fellow patients. So you write at one point in the book, quote,
No one ever taught us what our patients go through. What do you mean by that?
Physicians and providers and NPs, et cetera, they order lots and lots of tests. MRIs are miserable, right? And in the last 18 months, I've had 15 or 20 of them. So I think before you order this, please make sure you understand it ain't rosy.
Fanale also thinks some doctors need to work harder at their bedside manner.
I'm used to the past where everybody didn't think they didn't have to be nice. That's part of being a clinician. So that's the point I'm trying to make.
It's not to you an extra or nice to have. You think it should be absolutely mandatory for all the physicians to try to be.
Absolutely. It's a mandatory. Maybe you're having a bad day, but I think your patient's having a worse day. That's the point I'm trying to make.
As for what patients should know,
yeah, I think it's always good. It's very hard to answer this question, but always good to have an advocate of some kind that can work the system for you. Everybody knows somebody that works somewhere in the system, and sometimes playing that card is the right thing to do. Pushing your physician to be a little more responsive is always a good thing, and having them advocate for you.
Fanale's book is available on Amazon. He says all the proceeds will be donated to the Dana-Farber Cancer Institute. Ted Nisi, 12 News.